Hi everyone, my name is Emily Baldow, and today I'm going to be presenting a nutritional intervention for Crohn's disease. Crohn's disease is a type of inflammatory bowel disease. It involves swelling and inflammation of the digestive tract. Some signs and symptoms of Crohn's disease include abdominal pain, fatigue, weight gain, diarrhea, weight loss, and malnutrition. Crohn's disease can lead to some life-threatening complications. There's no cure for it, and the causes of it are not known. I have included over here a picture of what someone with Crohn's disease, what their intestines might look like. You can see there's a lot of fat around the intestine, the walls are really thick, they have some cracks in them. The area that the chyme and digestive food passes through is really thin and really bumpy and cobblestoney. So you can kind of imagine just how uncomfortable it is just seeing this picture. So the problem that this study tried to address in regards to Crohn's disease is the actual treatments, for Crohn's disease. So one of the treatments for Crohn's disease is drugs, like prescription drugs and medication. But the problem with that is those drugs can suppress the patient's immune system, which puts them at a higher risk for infection, and lots of other problems, and so it's not really ideal to put the patient on prescription drugs. And then another one is an actual nutritional treatment, but it's a very demanding nutritional treatment. So this study tried to sort of address both of those in its formation of a solution and treatment of Crohn's disease. So some additional stats and facts of Crohn's disease. 1 in 100 Americans are affected by it. Caucasians are more affected. People are between 1.5 and 28% of people with inflammatory bowel disease have a relative with inflammatory bowel disease. So you can kind of conclude from that it's possible that Crohn's disease might be hereditary. And adolescents are more commonly affected by Crohn's disease. And so the current nutritional treatment that I mentioned earlier is this first one in terms of dietary solutions for Crohn's disease. It's called the Exclusive Enteral Nutrition, or EEN. And again, this is sort of what the study called like the gold standard of nutritional treatment for Crohn's disease. Then the second one is what the study proposes to kind of be a new nutritional treatment for Crohn's disease. And it's called Crohn's Disease Exclusion Diet with Partial Enteral Nutrition, or CDED with PEN. And so again, this is sort of the standard that's used today, and this is what the second one is what this study proposes to be the new possible standard. So going into the first one, what the standard is today, the gold standard, it's a tube feeding diet, so you're not allowed any other oral intake while you're on this diet. Usually it's used as a first-time treatment in pediatric Crohn's disease patients. The diet lasts for 6 to 8 weeks, and it's typically done by a nasogastric tube, and I have a picture here of what that is. So it's a tube that runs up the nose and back down the esophagus and into the stomach, and it's usually attached to some type of formula up here. And they think it's superior to corticosteroids or medication because it induces remission, and it also doesn't suppress the immune system. But again, it is still a very intense treatment. So the second one is what the study is actually proposing, and this is the CDED with PEN. I have a kind of formula down here for kind of understanding it a little bit better. So part of the diet includes something like a NG tube, so some type of formula feeding. And then the other part of the diet includes just eating whole foods. So that equals CDED with PEN. And I should add that the whole foods that the patients do eat are very restricted. So they have sort of guidelines, and we'll go through those in a little bit of what they're allowed to eat and what they're not allowed to eat. So getting into the methods of the actual study, the people involved in the study were divided into two groups. The first group was the CDED with pen group. So 50% of their diet involved whole foods for the first 6 weeks, and then the other 50% of their diet was partial enteral nutrition, which again is something like tube feeding or nasogastric tube feeding. And then the second 6 weeks, so the last 6 weeks of the study, they went down to 25% tube feeding and 75% whole foods. And then the second group, this was the EEN. They were EEN for the first 6 weeks. That means they were completely tube feeding for the first 6 weeks with no whole foods, no other type of food. And then for the second 6 weeks, they went down to 25% tube feeding and 75% whole foods, but their diet was not restricted. They could, I think, eat whatever they wanted to. And it says up here, all patients were exposed to partial enteral nutrition and a free diet by week 12. So this is the exclusion criteria for the people kind of in the study or that were trying to get into the study. It's kind of a intense criteria, but if they were already in remission, they couldn't join the study. If they were receiving steroids or any type of immunomodulator in the previous 8 weeks, they couldn't join the study. If they were pregnant, if they had arthritis. So not just anyone could join the study. There was a kind of intense exclusion criteria. And then another part of this study were some checkups the patients had to do. They were seen at weeks 3, 6, and 12. They had to talk to a dietitian on the phone at weeks 1 and 9, and they were encouraged to call a research dietitian hotline if they had any questions while they were at home or anything like that. There were also fecal tests, blood tests, and PCDAI, that stands for Pediatric Crohn's Disease Activity Index, that was assessed each visit. So it kind of includes a lot of different things, but like their weight and their how often they're going to the bathroom, and just kind of like a lot of different things are assessed during that visit each time. And then their intestinal permeability is also assessed, and it was assessed at weeks 0 and 3. For those of you who don't really know what intestinal permeability might be, I have a picture here of kind of what it is. So you can see over here, this is a leaky gut. So the gap junctions are kind of gone in the leaky gut, and all these viruses and bacteria are getting into the bloodstream, versus this one is a healthy gut, and those tight junctions are in place, and none of the bad stuff are getting through. So someone with Crohn's disease might have a leaky gut like this, and their body might be really infected with a lot of issues because of this leaky gut problem. And like I said before, the people that were on CDED, so I think it was group 1, CDED, remember, is the people who could eat whole foods, and they also had tube feeding the whole time. They had a really strict diet. So this is the diet was kind of divided into 2 stages. The first stage was the first 6 weeks, and the second stage were the second 6 weeks. And this is what they could eat during the first 6 weeks. And they had different kind of categories. So mandatory items that they had to eat every single day, allowed foods daily, so things that they could eat for like a snack or something, and then allowed foods daily, like that's some more of them. And then foods that they could only eat once a week, so that included fish, and then disallowed foods, which I'll show a little later. This is the second stage of the diet, the second 6 weeks, and these are all the foods that they couldn't eat in the first 6 weeks besides this. The mandatory items stayed the same, but these are all the foods that they, again, couldn't eat in the first 6 weeks, but now in the second 6 weeks are allowed to. And there's a couple more criteria, so additional daily foods from week 7, so they couldn't necessarily eat these foods at week 6, but at week 7 they were allowed to, and then additional daily foods from week 10, so they weren't allowed to eat those from week 6 to 10, but now at week 10 they're allowed to eat them, type of thing. And then these are the disallowed foods, and they are the exact same for stage 1 of the diet and stage 2. So they're the exact same for all 12 weeks. The patients were not allowed to eat any of these. So no wheat, no animal fat, no dairy, nothing like that on this list the entire time. The outcomes of the study. So there's kind of a bunch of different outcomes from this study, and I kind of put it into sort of a Venn diagram because initially there are a lot of shared outcomes between the two groups of diet. So EEN and CDED, they both induced remission by week 6. They both decreased inflammation by week 6, and there were similar changes in the microbiome of the gut by week 6 in both diets and in those patients from both diets. The problem was after week 6. After week 6, the group the EEN group, after they started exposing themselves to foods and kind of not having any guidelines for what foods they should be eating and what foods they shouldn't be, they completely rebounded. So all the progress they made kind of went away, and they rebounded, and they were no longer in remission, versus the group that had been on the kind of exclusion diet and eating the whole foods the whole time, but also getting the formula, they stayed in remission the entire time. And so the conclusion is that the intervention was successful. CDED plus PAN resulted in sustained remission the entire time, versus EEN after the 6 weeks, once they started introducing real foods, it did not sustain remission. Some limitations and recommendations for the study include the mucosal linings were not assessed via endoscopy, and the calprotectin was assessed at 2 central laboratories. Calprotectin is something that shows up in your intestines if there is inflammation. So that was assessed at 2 central laboratories. And then the recommendations for the study: further research on the role of the CDED diet in conjunction with drugs can be done to possibly have an even further and increased effect on patients with Crohn's disease. These are my sources, and thank you so much for listening.